Today marks the first anniversary of the first lockdown as we tried to tackle the COVID outbreak.
It's a national day of reflection, providing a time to consider the impact COVID's had on our region, to remember those who've sadly lost their lives, and to think about the efforts and sacrifices everyone's made to help protect our communities, and to look with hope towards a brighter future.
Local agencies have been playing their part in the response to COVID through a very active local resilience partnership, working together to address COVID, support communities and try to ensure the continued provision of essential healthcare and public services.
Everyone has been affected to some degree, as we've been required to make changes in our lives in order to protect ourselves, our loved ones, friends, neighbours and communities.
Our communities have demonstrated fantastic community spirit throughout. They have supported friends and those who are vulnerable by supplying food and welfare parcels and making phone calls to stay in touch.
The actions people have taken by following the national guidance around wearing face coverings, physical distancing, hand washing, getting tested when symptomatic, and taking up the opportunity of a vaccine has also helped protect some of the region's essential services. Within health and social care, the challenge has been around retaining the fullest range of services possible, whilst also ensuring the safety of some of the region's most vulnerable people and crucially making sure we've got the capacity to provide vital help to some of those in most serious need, including those affected by the virus itself. At times, we've been under real pressure.
How do you deliver the core lifeline services safely? And that has been an enormous challenge for our hard-working teams, who for the past year have worked relentlessly in some of the most challenging circumstances anyone could have imagined. Looking back over the past 12 months, it just has flown, but at times it seems it has been forever. And you must feel the same. Many of us are weary. Some, particularly those in the NHS front line, health and social care front line, are exhausted. And we all just want to move on.
But while we're not out of the woods yet, there are some reasons to have faith and have hope that we're coming through.
COVID has proved a massive learning curve, dealing with a virus unlike that of the cold or flu. One of the key defences in the battle against COVID has been personal protective equipment, or PPE. It has quickly become a way of life across services.
And it has absolutely been critical to prevent transmission of this deadly disease.
Another major development over the last year has been the arrival of COVID tests at scale. These have allowed us to identify situations where people with symptoms such as raised temperature, new continuous cough, or change or loss to taste and smell, they're actually carrying the virus. It's helped us to stop them from passing it on to others, some of whom might suffer very serious consequences.
The availability of testing has grown throughout the year, and we are now able to test whether you have symptoms or not. Many of you will have seen testing stations across the region, and more are to follow. However, should anyone have symptoms, they should immediately self-isolate with their household and arrange to be tested.
The actions we have been required to take to limit the spread of COVID across our region has severely impacted on our local businesses and their employees. All businesses have been required to operate in different ways, and for some, such as hospitality and non-essential retail, they've been forced to close. That closure has been painful, difficult. Grants have been available, but there is a long road to recovery for many of our businesses.
COVID's also affected schooling, requiring many pupils, many of our children, to stay at home for weeks on end.
It's meant many people not being able to see their loved ones, which is so difficult.
The ask on everyone has been huge, but the efforts have worked.
At times, the region's critical care unit has been way beyond its capacity due to the numbers of COVID patients. We've teetered on the brink of being able to continue to provide emergency services, but we've never fallen off that. We've always just about been able to provide immediate care for people who needed them.
It has been challenging, But the professionalism, dedication of those staff have meant that we have been able to manage and care for our most vulnerable. Everybody's support has meant that up to now, we have got through the worst.
The skyrocketing case numbers we saw at the end of last year, the beginning of this year, were terrifying. But we've been able to manage.
But in recent weeks, your efforts and those of the partner agencies have managed to drive down the case numbers, and we're now at a much safer level across our communities.
The biggest single thing that is now underway is our vaccination programme.
To have effective vaccines within 12 months of the first lockdown is an incredible achievement from our scientific communities. And it's difficult to overstate how important these are in providing a way out of this situation and back towards the sort of normality that we all want.
It is thanks to this vaccination team and the volunteers that 70,000 first doses of the vaccination have been given across our region. We have maximised each and every one of the vaccines available to us. Residents and staff at our care homes, our most vulnerable, have now had their second doses, and that second dose rollout is now expanding at pace.
I'd like to pass on my personal thanks to everyone who's come forward to receive the vaccine. What you're doing is going to keep you safe, and it's going to keep our communities safe. It is so important that we continue to get such a high take-up of the vaccine locally.
We've now seen nationally that we have a timetable to move out of lockdown, and we hope we can move to something closer to normality.
But it is important that we stick to the rules. We must continue to do all we can to control the virus, stop its ability to spread, and give the vaccination programme the chance for us to finally get beyond this virus.
And hopefully, before too long, we're going to be in a better position looking ahead to brighter days.
Today, we do need to remember those people within our region who have lost their lives through COVID-19.
We need to reflect on the impact on their families, their friends.
We need to continue to work together as agencies, as communities, as families.
To do all we can to ensure that the future is COVID behind us.
And we need to thank everyone who's playing their part in tackling this horrible virus. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you for everything you've done.